Hi dear doctors, coming on to the kids covery. This is a beautiful pediatric initiative by me. I am your pediatric faculty, Dr. Par. The topic of discussion for today is the fluid management in pediatric patient. This fluid management is a question which is asked in vivas most of the times. How will you manage this and that and everything. So fluid management is important. So dear children, discussing with you holiday cigar method for maintenance IV fluid, holiday cigar. Okay, so what do you mean by this? See, understand, for first 10 kgs we have to give 100 ml per kg, then 50 ml per kg for each kg over 10 kgs, and then 20 ml per kg for each kg over 20 kgs. Okay, so let me just draw something for you. Yeah, so for example, if the child is falling under 10 kg, okay, then 11 kg to 20 kg, and then from 20 kg above. Okay, so 100 ml per kg, 50 ml per kg, 20 ml per kg. Okay, so for example, if a child is 10 kgs, then you have to give 10 into 100, that is 1000. If a child is 15, so of course 1000 has to be given, but for the 5 kgs above the 10 kgs, we'll multiply it with 50. So 5 into 50 is 250, total is going to be 1250. And in the end, the child who is, 25 kgs, for example, so of course 1000 we have to give, of course 50 into 10, 500 we have to give, plus 5 into 20, that is going to be your 100. So we have to give 1600 ml per day. Okay, or yeah, this much amount we have to give. So that's why it's important to understand that what is the normal urine output then. So in newborn and infants up to 1 year, 2 ml per kg per hour. In a toddler, it is 1.5 ml per kg per hour. In older children, it is 1 ml per kg per hour. In adults, it is going to be 0.5 ml per kg per hour. Okay, so very simple to understand that 1 year 2. So 1 year 2. Toddler is going to be what? 1.5. Older children 1. Okay, older children starting from O, so ONE 1 is going to be there, and adult is going to be 0.5 ml per kg. Now this table I am going to use at multiple places, that's why I thought of telling you beforehand. So thank you so much for watching, and God bless you.